Hi, so today I am going to show you guys how I'm dressing a wound. I have a blister on my hand that has ripped open and formed a sort of scab. Um, I think it's related to a type of eczema. So I've had eczema my whole life, but this is kind of new that I've seen this. From what I've been reading, it could be caused by potatoes, interestingly enough. So potatoes are in the nightshade family, and it can cause blisters on the skin. And this is really the only diet change I've had recently is adding in red potatoes that could have caused this problem. So plus, combined with stress and just the friction of training grappling and martial arts, I think that this has caused the blister to open. Now, I don't think the blister is infected, which is good. It's showing pretty good signs of healing, and it looks good right now. I have treated it with gentian violet. So gentian violet, I discovered has treated ringworm. It did an amazing job with a ringworm for me in the past. But gentian violet, it's a first aid antiseptic. It's used for minor cuts, scrapes, and burns. It prevents infection. It's antifungal, and it can be really helpful for short-term treatment of topical scrapes, burns, minor injuries. Now, you wouldn't want to use this on a huge, deep wound or something that's really bleeding, actively bleeding or anything like that, but it is really nice for a small abrasion or a smaller lesion. Okay, so I'm going to open this. It is stains incredibly strong staining. Okay, so I'm going to use a Q-tip to dip the Q-tip, and you can see on the Q-tip it is extremely dark colored. And I'm just going to paint onto my hand, starting with these smaller blisters that have not opened yet on my wrist and hand, and then ending with this larger blister that is healing on the top of my knuckles and hand. The dry weather has not helped with this, and the winter, the cold, has not helped with this. It's also on my knuckles, so every time I move my hand, it irritates this specific wound. And I fell asleep with this the other night. I took my bandage off because it was too tight to sleep in. It was uncomfortable, and this gentian violet got all over my face. So I've learned if you accidentally get it on a part of your skin that you don't want it on, rubbing alcohol or vinegar can be really helpful. Just a little vinegar was able to remove the gentian violet from my face. My husband told me I looked like the Joker, so that's definitely not what you want to look like when you wake up in the morning. Alright, so we're done with the gentian violet. Next, I'm going to use these non-stick pads. I got these at Walmart, and I'll just take one out so I can cover this area so the gauze doesn't stick to it. When the gauze sticks to the wound, it kind of gets debris stuck in the wound, and I don't like that. So I'm going to use this little non-stick pad. Okay. Now, I'm by no means done a lot of wound care as a nurse, but I have dressed some wounds before: gunshot wounds, burns, some necrotic tissue from diabetes complications, and some infections. And actually, I've seen a pretty wide variety of wounds at this point compared to probably what just the average person has seen. But I know wound care nurses who did this every day, and I was certainly not a wound care nurse every single day. So it's definitely not my area of expertise, but I have a good bit of experience just to do a good basic job and keep things clean and promote healthy growth and reduce the risk of infection with wounds. So I'm really covering this so I don't get this infected at jiu-jitsu or martial arts class. I also don't want to expose this wound to my training partners or students, of course. So keeping it covered, keeping it nice and dry is going to be really important. So since this piece here, it kind of is a large area, but it's two really small, like pinpoint sized blisters, I'm going to cut this in half. And just gently placing these on top of my hand. I have one little spot on my finger here, and the fingers are really difficult to cover, especially for martial arts class, because it's such a mobile area. Now, your hands are extremely important to treat and to take extra care of because it's such a mobile area and it's exposed to so many things. So infection can get really bad and spread up your arm to the rest of your body. So it's important that I don't want these little bones infected in my hand. I don't want to develop further complications. And of course, martial arts, grappling, a gym, any kind of area where you're sweating, you're exposed to other people's tissues and snot and spit and sweat and skin and blood, and you don't want those fluids to get into the wound. And I mean, it's obvious, like, why. So if you are in the gym and you happen to get an injury of some kind, then I really encourage you to take action really quickly so that you protect yourself and you protect your training partners. Now, this is my left hand, so it's extremely difficult to do because I'm using my right hand and I'm a left-handed. So I'm kind of we'll see how I do. I'm going to try to wrap it fairly tightly so it stays put. I have to make it through 4 classes today, and I want to make sure that my hand stays secure the whole class, or all of the classes. So I have pinched this off. I'm going to tuck this under, and then I'm going to apply some tape to help tape on the bandage. Now this is really easy. You can do this at home. I have not gone to an urgent care or anything because it doesn't look like it's getting infected. It doesn't appear to be getting worse. It's getting better. I have experience personally in wound care, so I feel comfortable, watching and knowing what the signs of infection look like. Now, if you just don't know, or you want to try to figure out more, then urgent care probably could be helpful for you, But the signs of infection that we would be looking for would be extreme redness, extreme swelling, streaking up the arm, a white pus look, green, or if it's malodorous. These could all definitely be signs of an infection. I'm not seeing anything like that on my hand, so I'm hoping to prevent that type of complication. Now, if I didn't cover this and I just continued not treating it and going to class, I think that I would have a high likelihood of developing a problem. I really don't need this exposed with what I have to do with my hands. So I'm just putting lots of tape on there to secure it kind of at every little area here. I like to rip the tape so it's thin and then use a good bit of it. I don't want it to reduce my mobility at all, of course, but I don't want to reduce the mobility of my hand, so that's really what I'm trying to avoid. I don't really like how that went, so I'm going to clip it out a bit, make a little room for my hand, and it's still nice and secure there. Okay, I'm going to, I got this cool little glove to put over it, so it'll actually help secure the the rest of the hand. I know that definitely people want to know what happened to me or what happened to my hand or why I'm wearing this. And so that's why I wanted to show you guys this video, and it's really, it's like, it's not that bad, but it's not good, you know what I mean? So I just want to be the safest possible with spreading diseases or bacterial infections, that kind of thing. So just wrap it up. I would hate to use this hand and like put it on somebody's face. It's really gross. I wouldn't want someone to do that to me. I would be really upset and like, what the heck is wrong with you? If a training partner knowingly had a type of wound or a lesion on their hand and then didn't cover it, I feel like that's extremely rude and bad sportsmanship, whether you're competing or just practicing, just training at class. And I don't really have the option. This isn't something to not go to class about, because my hands, there's really like nothing that wrong with it. Not to the point where it would prevent me from going to teach and coach some classes and do what I need to do. So thanks so much for watching, you guys. I'm going to use a little bit more tape, and then I'm going to apply my glove on. And I hope that this was helpful for anybody who's training like a high contact sport. If you happen to have an open wound, which is bound to happen by the time you get your black belt in jiu-jitsu, I promise you, you're going to have some scrapes, you're going to have some bruises, sprains, strains. This is all like super anticipated part of life, you know. This is just part of normal life. Okay, so this is good, and I'm going to show you this glove that I have. And I'll put it on this way, and this will just tuck everything nice in here and further provide some more protection. And you can't even really see the bandage here, which is exactly what I wanted. I wanted the bandage to be at the base of my hand so I could still move my hands. And now this has it's not even Velcro, it's like a cottony Velcro. It's not scratchy, so I can rub it on my face and it actually feels okay. So that's why I was like, well, this would be good for jiu-jitsu. Pull it tight and voila. Okay, I have a little gentian violet on my finger. It'll be okay. It's like getting Sharpie on you. So thanks so much for watching. I hope you continue to follow me for just simple health tips about all kinds of stuff that I come across, and just training tips if you go to the gym or do any kind of contact sport especially. Alright, see you later.